According to the Washington Administrative Code, nurse delegation is only allowed when the client's condition is stable and predictable. This means you must first assess the client's current health status, their risk for complications, and how likely adverse events are. Per the WAC, if a task or condition requires ongoing nursing judgment, it cannot be delegated. Bottom line, delegation is only legal when a safe outcome can reasonably be predicted. A client who is stable and predictable typically has a chronic but well-managed condition, requires routine, consistent care, doesn't have frequent hospitalizations or major medical changes, and maintains vital signs and assessments within their expected limits. Examples of this include routine diabetes management, routine catheter flushing, scheduled tube feedings, or simple wound care without infection. You must document this assessment thoroughly, and if the client does not meet these criteria, delegation is not appropriate. As a nurse delegator, you must continually evaluate stability. When a client becomes unstable, even subtly, the risks increase both for their safety and your license. This doesn't mean stopping delegation immediately, but you must stay vigilant and ready to reassess when the warning signs appear. Watch for things like increased oxygen needs, new wounds, frequent ER visits or hospitalizations, new medications requiring close monitoring, conditions prone to rapid changes like congestive heart failure, COPD, severe dementia, or acute infections. If your clinical judgment is needed regularly to maintain stability, delegation is likely unsafe. You're not expected to rescind delegation with every issue that comes up, but you must document, reassess, and intervene when necessary. Stay alert, ask questions, and document carefully. Small changes can have serious consequences, and your nursing judgment is vital. These are just examples, not an exhaustive list. Every client is different, and it's your responsibility to determine how you will recognize when a client is no longer stable and predictable. If the client is not stable and predictable, the risks increase. The task likely requires nursing care, not delegation. The caregiver may unintentionally cause harm, and you risk legal consequences for improper delegation. Remember the WAC that places responsibility on the nurse to assess and reassess the client's stability before and during delegation. Your clinical judgment is the final deciding factor. Delegation is ongoing, so caregivers must be trained to recognize and report things like signs of infection, changes in behavior, changes to skin integrity, missed medications, refusal of care, or new or worsening symptoms. As delegators, we need to make this clear. If something seems different, don't guess. Please stop and call me. Open communication helps you reassess delegation safety. Every delegated task requires documentation that confirms client stability and predictability, task appropriateness, caregiver training and competency, and your supervision plan. Be sure to also document any changes that affect delegation and any decisions to pause or rescind delegation. Washington state laws make delegation optional, not automatic. So if you're unsure about the client or the caregiver, you must say no or rescind delegation. Trust your training, know the laws, document decisions, and never delegate under pressure. Check out the link in the description that covers the right to refuse delegation. It actually says, the nurse may refuse to delegate a nursing care task to a caregiver if the nurse determines that the delegation is not appropriate. The nurse is not subject to employer reprisal for refusing to delegate when it is inappropriate to do so. This means that the nurse has full discretion to decide whether delegation is appropriate or not. If the nurse believes that delegating a task would be unsafe, beyond the caregiver's capability, or outside the scope of the law, they can refuse and legally cannot be punished by an employer for making that professional judgment. So, determining whether a client is stable and predictable is not just a clinical task. It's a legal and ethical responsibility that protects both your license and your client's well-being. Delegation is never a one-time decision. It's a dynamic, ongoing process that requires your professional judgment, clear communication, and thorough documentation. When in doubt, pause, reassess, and document. Trust your clinical instincts and know your authority under the law. Feel free to leave a comment that may help other delegators or caregivers because we can all learn from one another.